Good evening, everyone. This is Christina Campbell and Pamela Hyen and Jan Wager with Healthy Respiratory System. This is part of our Prevention Plus series, and I just want to mention that we are going to begin to professionally record these starting tomorrow. Healthy Bones will be the first one that we record so that you guys can have these from CrownDiamondTools.com and share them with others. We're real excited about that. But we just want to welcome you this evening and thank you so much for being a part of our team and being ready and willing to learn something new tonight. This is what you're going to be learning. You're going to be learning the importance of clean, fresh air, how the respiratory system functions, what causes respiratory infections, ways to support the respiratory system, steps to heal from chronic respiratory illnesses, and effects of toxic chemicals. So let's answer the question, what is respiration? And actually it is the process of the lungs expanding and contracting, letting the oxygen in and the carbon dioxide out. This supplies life-sustaining oxygen to the body. It removes waste products, and that waste is the carbon dioxide. The respiratory process actually starts at the nose and mouth. There are small hairs in the nose called cilia that keep the air passages clean and filter out large particles. The air then travels into the windpipe or the trachea and then divides into air passages called bronchial tubes. And bronchial tubes pass through the lungs into smaller, tiny little air passages called bronchioles. And we're trying to show you the alveoli that's enlarged here in this picture that are part of those bronchioles. There are over 300 million alveoli that act as little filters in those little bronchioles. The mucus in the trachea and bronchial tubes keeps the air passages moist, to stopping dust and bacteria and viruses, allergy-causing substances and other substances from entering the lungs. Impurities reaching deeper parts of the lungs are moved up via this mucus, and then it's coughed out or swallowed. And you can see the system here, the nose going down into the trachea, the two lungs, and the bronchial tubes, and going down into those bronchioles, and then the little alveoli sacs. And then here's the mucus. And the cilia they're like little brooms that kind of just wave and pass, kind of brush out or sweep out any of the bacteria and particles that are causing irritation to the lungs. So the heart pumps the blood, providing oxygen to the cells of the tissues and organs, and carbon dioxide is then produced and absorbed into the blood. The blood carries the carbon dioxide back to your lungs through the capillaries, and then it's removed from the body through exhalation or exhaling. So that's what you're going to see. Well, you actually can't see it, but when you breathe out, then you're breathing out that carbon dioxide. You know, many of us don't really know how to breathe properly, and we don't breathe deep enough. We need to get that oxygen down into those lungs, lifting that diaphragm and cleaning out those lungs. So many of us are, not exercising regularly, and this is something that we really highly recommend, of course, is at least 3 to 4 times a day, so that a week, excuse me, daily would be a bit much, but a week, so that you can get your heart pumping and get that oxygen in those lungs and oxygenate that blood and the cells. There are some accessory respiratory organs, and that is your diaphragm. The role of the diaphragm in breathing, you can see here that it's a large domed muscle underneath the lungs, and it contracts, creating a vacuum that causes a rush of air into the lungs. The opposite occurs with exhalation, when the diaphragm actually relaxes and the lungs deflate. So let's talk a little bit, now that you understand the basic idea of the respiratory system and how it works, let's talk about some of the respiratory disorders that you may be struggling with, or that, you know, friends and family that you know, neighbors, might be struggling with, or even just this time of year having particular problems, because we know that there are respiratory viruses in the air, and if we haven't taken preventative precautions, we may have succumbed to those respiratory disorders. So it's Elizabeth Barrett Browning made a statement. She says, "He lives most life, whoever breathes most air." So let's talk a little bit about asthma. I know that I have a lot of clients that come to me and ask me, are there any therapeutic grade essential oils that can address asthma? Respiratory disorder, this is a respiratory disorder affecting over 300 million people worldwide. And some of the symptoms of asthma include coughing, wheezing, tightness in the chest, airways becoming inflamed, narrow, and filled with mucus. The symptoms are triggers, and triggers are different for everyone, but basically things that kind of aggravate it are allergens, cold air, exercise, or emotional stress. So even though we were talking about oxygenating the cells in the lungs, you know, through exercise, if you're an asthmatic, then that is not an easy task, is it? Because that's actually going to exacerbate the problem. Essential oils should not be inhaled directly for asthmatic problems. Always apply to the soles of the feet, chest, or ingest. However, I have had people apply it to their chest, and we're going to talk a little bit about that here in a few minutes, and they've had no problem, but that is a note that was written in the Essential Oils Desk Reference, I believe. Let's talk a little bit about acute chronic bronchitis. This is an inflammation of the membranes lining the bronchial tubes, and some of the symptoms are coughing, mucus, which is clear, white, yellowish gray, or green in color. And of course we know that if it is green, that we have an infection. And Pam is saying that someone would like us to go into chronic sinus problems. And if we have some time, we'll go further into some of these things. But right now, we'll just talk about the bronchitis. Some of the symptoms are shortness of breath, made worse by mild exertion, wheezing, fatigue, slight fevers and chills, chest discomfort, and some of the causes are allergies, environmental toxins, and or just a basic infection. But when we talk about environmental toxins and chronic bronchitis, I know that it's pretty typical for smokers to have chronic bronchitis because they're constantly irritating those membranes, and of course that's causing inflammation, and then they're going to get those types of symptoms. But if you have an allergy to a specific, maybe laundry soap, it can actually cause asthma or chronic bronchitis, or you know, just fragrances that are not therapeutic grade essential oils, but maybe perfumes or fragrances that have chemicals in them. These can become irritants. I know one of my girlfriends, and I think her picture is in this particular presentation. She suffered from asthma for many years, and as she was discussing what had caused her asthma to begin with, her and her doctor had pretty much narrowed it down to her use of Lysol spray. And we have to be very careful with these types of aerosol sprays. You'll notice that if you've ever used Oust, the spray Oust, if you look on the back of the can of Oust, it actually states, there's a warning label, and it states, "Do not enter the room children, pets, or adults for 24 hours after spraying may cause irritation in the mucosal lining of the lungs, the throat. I mean, and yet on the TV commercials, on the advertisements, they show mom and the little children and the dog in the kitchen spraying these chemically toxic aerosols and then breathing them in, and we know that they can cause things like chronic bronchitis. Another respiratory disease is emphysema, and this is where the air sacs or the alveoli that we were talking about on the end of the bronchioles are enlarged and become damaged. Once they become damaged, it's very, very difficult for them to rejuvenate. But you know, we have a theory in our house that we believe that God gives our bodies the ability to heal themselves if we give them the proper tools. And so some of the symptoms of this emphysema is shortness of breath, rapid breathing and wheezing, chronic cough again, could be with or without the saliva, the barrel chest, overinflated lungs because we're doing everything that we can to get the air that we need. And many of the causes of emphysema include smoking, of course, deficiency of alpha-1 antitrypsin, AAT. This is an inherited condition. Industrial pollutants, non-tobacco smoke, physical damage caused by an accident, or scarring from whooping cough, acute bronchopneumonia, tuberculosis, and asthma. Another one is another respiratory disease could be the URI, or upper respiratory infections. These are infections that affect the throat, the sinuses, the larynx, the trachea, and the bronchi, excuse me. Symptoms include coughing, runny nose, nasal congestion, or post-nasal drip. It's amazing how the body is constantly trying to get rid of that thing that irritates. So you see with just about every respiratory disease that we have coughing, sneezing and coughing. And we actually have that twice on this slide. Sore, scratchy throat, painful swallowing, malaise and fever that can last up to 2 to 14 days, can linger for several weeks. And right now, this virus that's going around, it's just really hitting everybody, and then, well, not everybody, but a lot of people, and then coming back around and getting you again. This virus has all of these symptoms. It starts with a really dry, tickly, scratchy throat, and then it can either go directly into the lungs or it can go up into the nose and give us a lot of nasal congestion and stuffiness. Did you know that there are over 200 different viruses annually, new ones that come out here in our country? And flu vaccines are not effective at all for upper respiratory infections. Okay, how about cystic fibrosis? This may be something that you're not familiar with. This is a glue-like mucus buildup affecting the intestines, the pancreas, and especially the lungs. The symptoms are diarrhea that doesn't go away, foul-smelling, greasy stools, frequent episodes of wheezing, frequent episodes of pneumonia, persistent cough, skin tastes like salt, poor growth, chronic sinus infection. This is an inherited disease due to mutation in a gene, and there's absolutely no known cure, but we do know that there are some therapeutic great essential oils that can help lessen the symptoms. So we'll talk about that in just a minute. Pharyngitis, this is inflammation of the throat, and of course symptoms include sore or red throat, a lump in the throat, the feeling that there's a lump in the throat, fever, swollen neck, lymph glands. You know, this is when you've got a sore throat, folks, difficulty and pain swallowing, and the sore throat may or may not be strep. 90% of pharyngitis is viral. Some of it can be bacterial. Some of it's just could be inflammation of the tonsils, tonsillitis. It's related Pharyngitis is related to a minor illness such as a cold or flu. A lot of times it's in conjunction with a cold or flu. Injuries or irritants such as smoking, postnasal drip, allergies, and inhalation of toxic chemicals can also be the causes of pharyngitis or inflammation of the throat. The next one, severe acute respiratory syndrome, this is called SARS, severe acute respiratory disease of unknown etiology. Some of the symptoms are fever, dry cough, shortness of breath or difficulty breathing, appear in usually 3 to 7 days, but maybe as long as 10 days, and the causes are a virus, which is spread mainly through the contact with infected saliva, droplets from coughing, or sharing food or drink. And pneumonia. This is the lower respiratory tract lung infection, which may not require antibiotics. Symptoms are coughing, fever and chills, shortness of breath and chest pains, weakness, fast heartbeat, diarrhea, nausea, and vomiting, and mild symptoms called walking pneumonia. This is just the mild symptoms. Usually clears up in about 2 or 3 weeks. Not all pneumonia is bacterial, however. And here's a couple of testimonials on walking pneumonia. I would easily get walking pneumonia every fall and winter. I would go through a series of antibiotics and feel okay for a while, and then back to more walking pneumonia. I started to fill a veggie cap with oregano, thieves, lemongrass, and emu power to experiment on what oils would do. And what these oils would do, I am happy to report they worked very well for me. I am so happy I tried them. Now when I feel congestion coming on, I know these oils will do the trick. And this is from Margie in Ohio. The next one is from Christy in Wyoming, and she states, my first experience with Young Living oils was in 1999 when I was very ill with pneumonia. My doctor wanted to hospitalize me and use IV antibiotics, to which I refused both. A friend brought thieves and raven to me, telling me to put thieves on my chest and raven all over the bottom of my feet, and to use raven all over my chest and thieves all over the bottom of my feet again when I went to bed, which is exactly what I did. The next morning when I awaked, I was all but totally well. The next morning I awakened all but totally well. I was astounded at the healing that had taken place. I have been using oils ever since and always will. Great pneumonias. Here's a little information about clinical pneumonia, inflammation of lung tissue from poisons or toxins. The symptoms could be burning of the nose, eyes, lips, mouth, and throat, dry cough, chest pain and painful breathing, nausea. Some of the causes are substances including liquids, gases, and small particles such as dusts or fumes. I want to mention that years ago when I went to the clinic, I think it was in 2003, when the clinic was in Utah, there was someone there, I'm not going to mention any names, but she had been in there because she had had toxic chemical exposure from putting chlorine bleach in a bucket of water and adding ammonia to it, and it basically strangled her. I mean, the fumes came up and just really gave her lung tissue a run for its money. She ended up having to come to the clinic, and she was there for quite a few days just getting her health back into order. She was an elderly woman. She was well into her 70s at that time, and she has now since completely rejuvenated that damage. But we have to be very, very careful, and so that's why we're grateful for the Thieves Cleaner, so that we don't have to worry about mixing those toxic chemicals and then breathing them in. Factors that determine the severity and signs and symptoms: the type and strength of the chemical, the length of exposure, the exposure environment. I mean, she had to have been right over that bucket. The protective measures used, I mean, she probably didn't put anything over her face or mouth. She didn't think that it would give her that kind of reaction. Prior medical condition, of course, Age has a lot to play in this, you know, health of the lungs and form of chemical, gas, vapor, particulate, or liquid. A little bit about tuberculosis or TB. This is an infectious bacterial disease. The bacteria is called tuberculous bacillus, and it's transmitted through the air that mainly affects the lungs. The symptoms are fever, weight loss, chest pain, loss of appetite, night sweats, coughing up blood. Only about 10% of the people infected ever develop TB. Many of those who suffer with TB do so in the first few years following the infection, but the bacillus may lie dormant in the body for decades. In other words, we become carriers of the bacteria, but we don't actually come down with the symptoms. So it can be fatal if left untreated if you do come down with the symptoms. We have a lot of great research on oils that have been done, have been used to actually kill that bacteria, and we're going to talk about those. So let's talk about essential oils for respiratory relief and support. We've talked about how the respiratory system works in general, that, you know, pretty basic. We're not getting into a lot of heavy-duty medical stuff. And then we talked about some common respiratory diseases that you have probably heard about. And now we're going to give you that relief and support. We're going to talk first about frankincense. And you're going to notice, if you've been with us on, you know, subsequent webinars, that some of the oils come up again and again and again. And we try then, when we bring them up, for example, in this respiratory, we try to just hone in on those attributes that are speaking directly to the respiratory system. So we know that frankincense is a powerful anti-inflammatory. We know that it's antibacterial, and we talked about some of the bacterial and viral respiratory problems, diseases. We know that it's anti-tumoral, which means that it has ability to shrink tumors. It's antiviral and antifungal. And I believe that we're seeing more and more cases of fungus in the lungs or mold in the lungs. And we didn't really talk about that as a disease, but I want you to be aware that if there's something chronic going on and, you know, we're not being able to really identify what the problem is, it could be very well mold or fungus. Frankincense calms and reduces anxiety, deepens cellular respiration, so it brings oxygen into the cell. It's great as an expectorant. It can help to relieve coughing. It's an antiseptic to the respiratory tract. It also helps to stimulate the immune system so that we can stay at a place where we don't get sick because our immune system is boosted up. And it's an antidepressant. Another oil that's very, very good and has a special affinity to the respiratory system is hyssop. Hyssop is a biblical oil, as is frankincense, and it has been proven to be a decongestant. It too is an anti-inflammatory, it's antiviral and antiseptic. It has antibacterial properties. It's a great expectorant, and that means that it has the ability to liquefy mucus. So if you get that thick mucus and you can't get it out, it's stuck between your, it seems like your nose and your throat, or it's clogging up your ears, you know, in the eustachian tubes, and you just feel very compacted with mucus. Try a little hyssop on those areas, maybe on the mastoid bone on the back of the ear, or on the throat, or on the sinuses. You may want to mix it with a little V6 mixing oil. It's not as hot as cassia, but you know, some people are very sensitive anyway. I know I am, and I usually mix any of the oils with a carrier oil if I'm going to put it directly around my face or around my eyes, that soft skin around the eyes. But you know, other oils like peppermint oil, I can put that on that mastoid bone and not have any trouble at all. It also helps to relieve bronchial spasms, and it's effective for treating colds, sore throats, flu, bronchitis, and asthma. And Pam, if you would check to see if there's someone unmuted that we're getting some kind of feedback from, and maybe, okay, I think it sounds better now. I got some of this information, at least the top statement from the Complete Guide to Aromatherapy by Salvatore Battaglia, and that was an Italian aromatherapy book. Here's my girlfriend Loretta, and if you saw the 12 Oils of Ancient Scripture PowerPoint presentation or webinar, you saw this particular testimonial in that as well, because frankincense and hyssop are in the 12 Oils of Ancient Scripture. And she says, I was overusing her Rescular inhaler, and this is the woman that I was talking about that her doctor had, basically they had come to the conclusion that it was the Lysol that had caused her her asthmatic problem. She had been an asthmatic for over 35 years. The doctor told her that she could have killed herself because she was using her rescue inhaler too much. And this was in 2007. That's when I met Loretta. She started to use frankincense and hyssop on herself for respiratory relief. She says, I started rubbing both those on my feet first with some relief, then on my feet and my chest. Bingo. I can breathe freely without the aid of my inhaler. And I will tell you that she has not used her inhalers all the time that I've known her. There was a period of time, a very short period of time, I have to add this, that she quit using some oils, her oils, for a few months, and she had an asthma attack. Now, people sometimes ask, well, do I have to use these oils for the rest of my life? Remember, Loretta had asthma for 35 years. These are not magic bullets. They don't, one drop of oil isn't going to heal your lungs overnight. She needs to continue to use these on her lungs until they heal themselves. The body has the ability to heal itself if we give it the right thing. So she says, I've not had asthma problems since. What a blessing it is to have God's oils in our presence. And I agree with her 100%. So the next oil we'll talk about is peppermint and how we can use peppermint. It's a great pain reliever. So when you're getting that sinus congestion and it's throbbing in your head, you may want to use the peppermint oil on your sinuses. It helps to reduce fever. It's an effective expectorant. I have to tell this story. Quite a few years ago when I first started, my daughter was working about 5 miles from me, and she called me one night and she says, Mama, you need to bring down your peppermint oil. I am so stuffed up. I'm just miserable, and I'm here at work. And so I said, sure, I'll bring it down. So anyway, she said, I can't hear. I can't breathe. My head is pounding. And I said, well, here's the peppermint oil. And she grabbed the bottle from me, and she proceeded to put it straight on her sinuses, under her eyes, under her nose, on the mastoid bone behind her ear, on her throat. I mean, she just saturated herself with it. And I said, be careful. You don't want to get that peppermint oil in your mouth. I mean, in your eyes. It'll sting. And she says, I don't care. I just feel miserable. Well, we were visiting, and clients were coming in. Her clients in the store were coming in, and we were visiting for about 10 minutes, and within 10 minutes, her nose began to run like nobody's business. She's one Kleenex right after another, blowing all of this stuff that had been compacted. Her ears popped. She could hear, and the pressure in her sinuses just started to be alleviated. So it happened within 10 minutes. There's another testimonial here by Sheila. She said, I had an upper respiratory infection that turned into chronic rhinosinusitis. It was stuffy for 3 months. I can't imagine being stuffed up for 3 months, not being able to breathe through my nose. She says, I had tried many herbs, steams, snuffs, and oils without success until peppermint oil. I put 2 drops on my tongue and on the roof of my mouth, and in a few minutes I was breathing through my nose. Every time I got stuffy after this, I repeated the process. I started with a few times a day, and in 3 days I was better. So you can see that we can see a big difference between Young Living therapeutic grade essential oils and other oils, because she said she used oils without success until she used peppermint. It's an effective expectorant. It gets rid of that mucus. It alleviates spasms. It's a fever reducer. It opens the respiratory tract. It inhibits growth of pathogenic bacteria. It provides instantaneous relief in most cases, especially if you put it on the tip of your tongue like she did. You can rub it on the chest. You can put it under the nose. You can place it on the tongue. You can rub it on your sinus areas. Again, if you have sensitive skin, you might want to dilute it with V6 for skin sensitivity. The next two oils we'll talk about are Eucalyptus radiata and Eucalyptus globulus, two of the most valuable oils for treating the respiratory system. Now, I'm going to tell you that this year has been the worst year for me in getting this upper sinus congestion. And I don't know, I probably just haven't been taking care of myself the way I should. I've been working really hard and running around and doing classes and, you know, just kind of like a crazy woman and not taking care of myself. But I do want to tell you that because I have almost all of the oils, I have the Aroma Complete kit, and most of the oils are in there. I have the radiata, the globulus, the peppermint, and when something hits you, you can go and you can use these oils. One, you know, for a couple of hours, you might want to diffuse some, like the radiata. You might want to take the globulus. What I did was I put about 5 or 6 drops of the Eucalyptus globulus in a teaspoon, and then I added about half a teaspoon of agave, and then I took it internally because it's so great to as an antispasmodic. It's great as an anti-inflammatory. It's great for coughs. I like Eucalyptus globulus for that. The Eucalyptus radiata, I love to put it in my bath. Put it in with some regular bath gel, some Young Living unscented bath gel, about a teaspoon or quarter size in your hand, and then add 10 drops of eucalyptus, and then put it, mix it around in the water and let that steam just overtake you. And then you want to diffuse some of these oils as well. So look at what they do. They're mucus thinning, they're expectorants, they help with nasal and respiratory decongestants as a decongestant. And research shows that inhaling eucalyptus has immune modifying and antimicrobial effects. So you can use it topically, inhaling it, and the other suggestions that I made about how to use the oils. I think the next two are absolutely great oils as well, Eucalyptus Blue and Eucalyptus Dives. Now, I use Eucalyptus Blue a lot. I like it for my grandbabies. It's very aromatic. It has properties that clear the sinus and the bronchi. Remember, we talked about that. You want to diffuse Eucalyptus Blue and breathe it deep. So diffuse it in your bedroom at night if you're dealing with some kind of respiratory thing, and it'll just work its way into those little alveoli sacs, where it can heal. It's healing to the throat, lung, and sinus. It will heal sinus infections. Eucalyptus Blue has the highest amount of alpha-pinene, which lends it to being highly antimicrobial. It's an expectorant. Both of them are. They support normal respiratory function. Eucalyptus Dives has more specific antibacterial action than the ones that are good for viruses. So one is antibacterial. The other, Eucalyptus Blue, is just good for all types of microbes, both viral and bacteria, but both of them are also anti-inflammatory. Okay, well, I'm going to kind of turn it over here to Jan. We don't hear from Jan very much in presentation, and I'm just looking forward to what she has to say. She has so many great testimonials. Jan, welcome.
Thank you so much, Christina, and I just want to thank you for this presentation so far. My goodness, this is very powerful. You guys have done a superb job on this. I'm learning so much myself. Well, now we're going to move on to RC, which stands for respiratory congestion. Duh, it's pretty wonderful. And this is absolutely one of my favorite oils for the respiratory system. It decongests sinus passages and it relieves allergy symptoms. You know, the oils that are in RC are some of the ones we've already talked about. There's Eucalyptus globulus, Eucalyptus radiata, peppermint, and there's myrtle and spruce, Eucalyptus citrodora, lavender, marjoram, and cypress. And these oils in this blend are so effective. They're anti-infectious, antibacterial, anti-inflammatory, and antiviral. And when you have an infection in your respiratory system, whether it's in your lungs, in your throat, in your head, you can reduce the infections with the application of this oil. We apply this oil topically, and it will open and disinfect the bronchial tract. It also helps to promote lymph flow, which is really an important thing when you've got an infection going on. And superb for chronic coughs and even for tuberculosis. You know, you can apply this on your back, on the bottoms of your feet. This is also a great one for diffusing. We love to diffuse this in the bedroom at night if someone's got a respiratory problem going on. Great, and the beautiful thing about this is wonderful for children and adults. And what we do in our family is the first sign or symptom of anything to do with the respiratory system, whether it's sniffles or congestion, we get out the RC and we apply it topically and we diffuse it. And it's just superb. And you can use it alternately with the next oil that we're going to talk about, actually the next two oils that we're going to talk about, which are Raven and Raven Sarah. So, Christina, if you can go to the next slide for me, that'd be great.
I'm sorry. It was just working a little slow there. There we go.
Okay. Yeah, and you know, Raven is another blend that we have, and it is, again, highly antiviral and antiseptic. Raven contains Raven Sarah, wintergreen, Eucalyptus radiata, lemon, and peppermint. This is an excellent, excellent oil for the respiratory system, in particular for respiratory diseases such as tuberculosis, influenza, pneumonia, and sore throats. Again, it acts as an expectorant. Really great at reducing inflammation of the nasal mucous membranes. Also, if you've got a bunch of coughing going on, it can help to suppress coughs and also help to clear the lungs and reduce nasal congestion. And the other beautiful thing about Raven is it will actually help increase respiratory capacity. Now, what we've done is Raven is one of the key oils in, Raven Sarah is one of the key oils in Raven. And when you learn about Raven Sarah, you find out that in Madagascar, which is one of the places we obtain this oil from, they call it there, that the people indigenous to Madagascar call it the oil that heals. And it comes from the leaves of the plant. And we also have Raven Sarah in our blend called ImmuPower. And with this one, you'd apply them on location around the Vitaflex points, and you also diffuse. And now we come to my number one line of defense. Oh, we have Melrose. I guess I must have missed Melrose in my notes. Well, Melrose, this is just a superb oil, and we've mentioned this already today. Great for regenerating damaged tissues, also reducing inflammation. And Melrose, it has the melaleucas in it, it has rosemary and clove, so it is antibacterial, antifungal, and antimicrobial. The beautiful thing about Melrose, it's very gentle. It's very gentle. It's so wonderful for children. When my grandchildren complain, and here's a testimonial right here. A friend called one night and asked if I had anything for an earache. I could hear her son crying in the background. She came to the house and I gave her some Melrose. She said she put it on the back of her son's ear, down behind the ear, along the jawbone, along the eustachian tube there. He quit crying and he lay down and he went to sleep. And you can also put a little drop of this Melrose on a cotton ball and then place that in the ear opening for earaches. And because this is antibacterial and antimicrobial. Whatever infection is going on in there, typically with 1 or 2, maybe 3 applications, if you get it right away, you can clear up an ear infection. And I've seen it with my grandchildren. It's been wonderful. And it has a good smell to it also. Okay, maybe the next slide is going to be these. I'm thinking it might be. It is. Okay, this is my #1 line of defense. Thieves oil is a very interesting oil. And for those of you that are new to Young Living, it was created from research that was done of a group of 15th century thieves in Europe who rubbed oils and tinctures on themselves to avoid contracting the plague while they were robbing the bodies of the dead and the dying. And when they were apprehended, they had to tell the king what they were using, and it turned out they were spice traders, and they were using things like clove oil and cinnamon bark and rosemary and lemon and eucalyptus radiata to protect them from whatever it was that was killing these other people. So our formula, our thieves formula, is based on that ancient knowledge, and this formula is probably one of the most antiviral, antibacterial, anti-infectious formulas that we have. I carry this in my purse. I wouldn't go anywhere without it. It amplifies your immunity. It promotes circulation and lymphatic function. And one of the really, really key things about this blend is it inhibits the growth of toxic mold. And there's so many stories about that. And you mentioned, Christina, about the fact that you're believing that more and more people actually have mold in their respiratory systems. And it certainly could be possible. And boy, that's one of the reasons why I use thieves every day on the bottom of my feet. 2 drops on the bottoms of each foot, just as a protection for my body throughout the day. We use it on our grandkids. And for children, this is wonderful because, you know, even if they're little ones, you can put it on the bottom of their feet. And we also, another way to get thieves in your body, to get it directly, you can put a few drops in a capsule and swallow it. For children, you can actually put a drop in a teaspoon of agave, and we always add a drop of hyssop to it if there's any big respiratory thing going on, and just twirl it around with a toothpick to get that oil mixed into the agave, and then have them swallow it, and they will do it with no problem. And there was that clinical study by Dr. Chow, Young, and Oberg that showed these blend kills 60 different species of gram-negative and gram-positive bacteria, 13 different fungi, and 2 different viruses. It's powerful, and you can apply it topically on the bottom of your feet. If you want to do it other places, you need to dilute it because it is a hot oil. You can also diffuse it in the air. It's just a superb oil. And there's a note right there, mixed with C6 for skin sensitivity if you're sensitive. And this is such a fabulous, fabulous oil that now we have taken it into several other products in our product line. And the next one coming up here is our Thieves Household Cleaner, which is probably the most wonderful new product we've had in a long time. And the Thieves Household Cleaner does contain the Thieves Essential Oil Blend, the therapeutic essential oil of Thieves in the household cleaner. It's very concentrated. It's 100% plant, mineral-based, biodegradable, complies with EPA standards. It doesn't just clean your home. It defends against the germs. It helps prevent the germs from coming back. And the beautiful thing is, different than all of these other household cleaners that are out there in the market, that when you go down the cleaning aisle in the grocery store, you almost gag because they're so powerful. It will not damage or hurt your respiratory system. In fact, it's supportive of your respiratory system and supportive of respiratory conditions. So if you're cleaning your home and you have some of these respiratory conditions we've been talking about, you will actually be treating yourself while you're cleaning because it's so, so safe. Safe for children, safe for pets, and this cleaner will kill toxic mold. I have replaced every cleaner in my home with the Thieves Household Cleaner. I use it on countertops, kitchens, bathrooms, and all the fixtures in the bathroom. 2 capsules straight in the toilet bowl. I use it on floors, cleaning carpets, tile floor, wood floor. I use it for my oven. I also add it to my laundry to help disinfect my laundry. And I use it in my dishwasher. A couple capsules of Thieves Cleaner and some white vinegar, and you are good to go. And your dishes come out sparkly clean. No need to wear rubber gloves, and it smells great, and it will not pollute the environment. This is something that I have on my auto-ship. I would not consider being without it. You know that bleach products, like Christina mentioned before, are very harmful to the respiratory tract. The fumes can cause serious damage to the mucosal lining of airway passages and lungs. aggravating conditions such as asthma, chronic bronchitis, or obstructive lung disease. So this should be your first line of defense. And it's so concentrated, my typical usage is 2 capsules in a quart spray bottle and then fill it up with water. And that's all you need. So it's truly, truly a fabulous cleaner. And then taking it a step further, other products that you can use that have the thieves in it for your health of your respiratory system. First of all is our Thieves Hard Lozenges that contain the Thieves Essential Oil Blend, which kills 99.6% of bacteria. These lozenges are just super for soothing sore, scratchy throats, helps to relieve coughs, and because we know this oil supports the respiratory system when you're sucking on a lozenge, it's benefiting your respiratory system. Now the mouthwash is just a takeoff from that, and the mouthwash is fabulous. There's nothing harmful in the mouthwash. In fact, it's even safe to swallow it if you like. Here's a trick that we've used. If you want to carry your mouthwash with you during the day, get yourself a little purse-sized spray bottle and fill it up with half mouthwash and half water. Shake it up and use it throughout the day for fresh breath. If you go out to eat and you can't brush your teeth afterwards, you can use a little bit of that. And I just push it in my mouth and I swallow it. And it's even great for kids, my grandsons. If they come up to their mom and say, "Mom, my throat's kind of scratchy," she'll let me, and they're out and about, she'll get her little spray bottle out and she'll spray it in their little mouth and they kind of swish it around and then they swallow it. And usually it'll just stop things in their tracks. And that's the key to all these things we've been talking about when you talk respiratory system challenges, is you need to have the oils on hand so that when something comes up, you can address it immediately and attack those viruses and those bacteria right away so they don't have a chance to replicate out of control. 2 great testimonials. This winter, there had been a respiratory virus going around and had tried to get me twice. At the first signs, I put RC on my chest and back or the lung area and a drop or 2 on my throat. Both times I did this at night before going to bed, and the next morning, no sign of the respiratory virus. And that's from Jan down in Texas. And another gal in Texas, we just love the Thieves Oil Blend. For colds and flu, go to Thieves. Sore throat, a drop of Thieves in water, gargle and swallow. Or try Thieves Spray. 1 spray does the trick. These lozenges are great too, especially for the little ones. And for the little ones, we have Thieves Soft Lozenges. And it's kind of like a chewable vitamin almost. So the little ones can have a half of one. And my little granddaughter, who's 2, she'll take one of those and just chew it up and swallow it. And it's totally safe. And they get that wonderful Thieves and an easy way to get it. And the Thieves cleaner is my cleaner for everything from cabinets and high chairs to all bathroom fixtures, doorknobs, and dishes. Thieves toothpaste is a must and safe for the entire family. And rolling on to the next product that's going to support your respiratory system and is so easy to carry around with you is our Breathe Again Roll-On. This contains these wonderful respiratory oils, the eucalyptuses, also Laurus nobilis, and our peppermint, and a new oil here in this blend that's so effective against inflammation is copaiba. There's also myrtle and blue cypress and eucalyptus blue. This particular roll-on is just super because it relaxes airways. It's convenient because it's a roll-on. Makes breathing easier and helps to reduce coughs, an anti-inflammatory property due to the copaiba oil in there. Also acts as an expectorant. It can help relieve the symptoms of colds and congestion. It's also anti-infectious, antiviral, and antibacterial. And this is great for guys and gals, even kiddos. You can roll it on your face, on your sinus areas, back of your neck, on your chest, on your throat, just wherever you need the relief. Just roll it on, and it's so convenient. Now, some of the oils we've been talking about are available in our beautiful Golden Touch 1 collection. This collection helps to support your body's natural defenses. And so we've got the great oil of Digest, which is super for supporting your digestive system. And Endoflex to support your, to balance and support your hormones. Juvaflex to balance and support your liver. And there's that Raven, RC, Melrose, and Thieves, those 4 great oils we've been talking about already. So you can get these in a beautiful collection. And they're 5 ml bottles. And this is one of those, this is kind of like my secondary line of defense. You have your 9 everyday oils, and then you have the Golden Touch 1 collection. If you have those 2 collections, you are pretty well set for most of the oils that you need. The next thing we want to talk a little bit about is little portable inhalers. And these are just great for carrying around the aroma of your favorite oil without having to take the whole bottle. Now, these are available from www.abundancehealthforyou.com. And they're small, so you can easily fit them in your purse, in your pocket, or a handbag. They're great for traveling. And, you know, we've also given these away as little sample gifts when we've done classes or just when we're introducing people to the oils. They're inexpensive, and it's a great way for someone to be able to at least get the inhalation effect of an oil. Put about 6 drops on the wick, put the wick down inside the inhaler, seal it up, and then you have a cover, and you can just enjoy all the benefits of aromatherapy on the go. So you have 4 or 5 different little oils with you and not have to take up much room in your purse. And going right along with inhaling, we're going to move on to, 3 just spectacular diffusers. Oh my goodness, I have all of these in my home, and they all kind of serve different purposes. But I will say is when you want a real therapeutic concentration of oils in a room, or you're really trying to clean the air in your home, the one you want to go to that's the most powerful and that puts the most concentrated amount of oil in the air would be the TheraPro diffuser. It's a spectacular diffuser. There's no diffusing of the oil. The bottle twists right onto the bottom of the diffuser unit, and it's electric. You plug it in, and air is pumped through, and the oil is brought up, and it comes out that little tip on the top in a very, very fine mist. And those oil molecules will get distributed throughout the room. Your room will smell great, and you will absolutely deactivate and get rid of environmental pollutants and toxins. And if someone comes in the home and they're coughing and they're sick, you can get rid of whatever they're coughing into the air by diffusing. If someone is sick and you want to get concentrated RC or Raven or one of the respiratory oils in the bedroom, then put that diffuser in the bedroom and diffuse it. The beautiful thing about that diffuser is it has a timer, so you can have it go on 5 minutes and off 5 minutes, or whatever combination of times that you want. Then the other 2 diffusers, the oils are diluted with water, and then actually it's like an ultrasonic thing where you get a cloud that comes out that almost looks like a dry ice cloud that you might see in a performance on a stage, but the oils come out within this cloud. They're very lovely and very soft, and they give you a wonderful smell, and it's just a less concentrated way to diffuse the oils. So let's talk about 90 days to respiratory health. Step 1, enroll to receive your wholesale membership. If you're not already in Young Living, this is how you want to get started as a wholesale member. And when we think about respiratory health, probably the best kit to get for respiratory health is the Start Living with Thieves enrollment kit. And you can see it has the Thieves Oil Blend, the wonderful toothpaste and mouthwash, our outstanding Thieves Household Cleaner, a wonderful foaming hand soap, a couple of sprays, actually 2 foaming hand soaps and 2 cleaners, 2 sprays, the wonderful take-along hand purifier, 2 of those, and a booklet. You also get, with this wholesale enrollment kit, you get a 5 ml lavender, a 5 ml peppermint, 3 Ningxia Red singles, and that great diffuser coupon for $40 off the diffuser of your choice. This is a lifetime wholesale membership with Young Living, and there's no annual fees involved. And you will get a 24% discount on all your future Young Living products when you start with a wholesale enrollment kit. So that's the way to go, the first step. The second step on your road to a healthy respiratory system is to enroll in our 90-day Respiratory Health Essential Rewards program. Now, the benefit of Essential Rewards is that you will, by doing an order once a month, you will start earning free product points with each shipment. The first 6 months consecutive that you're on the Essential Rewards program, you get 10% each month of the PV value of your product in points that are accumulated in a little tea bank. From 7 months to 12 months consecutive, you get 15% free points, and after 12 months, you get 20% points in free product. And I can tell you, I've collected my points for a few months, and I called the other day to see how many points I had, and she said, oh, you have 370 points. And I'm thinking, well, this is fabulous, because it's like $370 worth of free products. And I can pick whatever products I want, and they'll ship them to me, and I just have to pay the shipping to get it to my house when I get those free things. Now, the other benefit of Essential Rewards is the shipping is reduced. There are discounted prices on exclusive product packages, and you will never run out of your products. to ensure that your 90-day health plan is a success, and you always have in your home what you need to address those pesky little bugs and infectious invaders that can cause havoc with your respiratory health. And so the next step then is a few suggestions for what you might include in your respiratory health purchases. The first one might be that Golden Touch 1 kit we talked about, and maybe a bottle of Ravensara and Eucalyptus globulus. Now, these come to a little over $100, and you're going to get your 10% of free product points through the Essential Rewards Savings Plan. That's $10.80 worth of free products that you can redeem after you've been on Essential Rewards for 2 months. So this is one suggestion. Your next suggestion for an Essential Rewards order could include the next grouping of oils, which would be hyssop, Melrose, peppermint, eucalyptus radiata, eucalyptus dyes, and a great little pouch of those Thieves' Heart lozenges. And we've talked about all these oils and their value. And you know, the thing to remember with these oils is a drop or two per application is all you need. So in a day, if you have a sick child or you're sick, you might do hyssop 2 or 3 times. But in these, even in these small bottles, if it's a small bottle, you're going to get 85 drops, and some of the oils come in the large bottles like Melrose, eucalyptus, peppermint. They come in the large bottles, and they have over 250 drops or 285 drops in a bottle. So these are some very significant amounts when you consider how concentrated these oils are. And another suggestion for some kits is going to be one that includes that wonderful Breathe Again roll-on that we were talking about. And there is another bottle of Thieves, RC and Raven. These are all the large bottles, the 15 ml bottles. And so this is about $101 in wholesale price. And again, your rebate on this would be $10.10 on this order. So that's an example of what 3 Essential Reward orders might look like when you're thinking of, okay, I want to have on hand in my home those oils that I need to support my respiratory system and the respiratory system of my family. So moving on to step 3 in respiratory health, and this is really, really an important step, and we're running out of time here, but I want to make sure we cover it, and that is avoiding things to avoid in your home. You have to get rid of your toxic chemical cleaners. If you will only read the back and see the warnings on those, you will see how deadly they can be. Get rid of your artificial chemical synthesized room deodorizers. They are doing nothing but cover up the smells. They're doing nothing to really get rid of them or to clean the air. Get rid of your scented candles. Most of them are scented with synthetic chemicals. They're not doing anything. In fact, they're irritating. Over-the-counter medications can be less beneficial, can be absolutely not even beneficial. They mask the symptoms, and they're full of chemicals and synthetically created drugs that you can address most of these issues with these beautiful oils we've been talking about. And get rid of your fragrant laundry products. And in place of those, embrace air filtration. Just filtering and cleaning your air and diffusing your air with Young Living essential oils. Natural healing with Young Living essential oils and non-toxic household cleaning products. And I have replaced absolutely every single household cleaning product in my home with Young Living's household cleaner. I didn't think it was possible. I absolutely love it, and I know that I'm purifying my home at the same time that I'm cleaning it. I'm disinfecting my home. So please get rid of those plug-in air fresheners and all of the synthetic fragrances and chemicals, because they are really compromising your respiratory system. We have some great resources to help those of you that are new, that really need some tools not only for your own edification and for your own education, but also to share with others as you're learning about the value. Some of them are from Crown Diamond Tools, like this beautiful brochure on cold and flu defense, full of great information. On the right, we have the Thieves brochure. You can order those from Young Living. They come 25 in a pack for $7.50. And that brochure covers all the Thieves products that are so powerful in supporting your home and your respiratory system and supporting your immune system. And the middle resource is a spectacular resource called the Essential Oils Desk Reference. You get it at ylwisdom.com. They just changed their name to Life Sciences Publishers. But if you go to ylwisdom.com, it'll take you right to their website. And this is a brand new edition of the Desk Reference. and I understand they're going to start shipping it on the 20th of April. So we're all real excited to get it because I know most of us have ordered it. And it is packed full with all the information that we've talked about here about how to use all these oils. All of that is in that book. So once you get it, you'll know how to use all these oils beyond what we've told you tonight, what we've told you in this webinar. So I just want to encourage all of you to really embrace the value of oils for respiratory health, and welcome you to the wonderful world of Young Living. And Christina, what other comments do you have? What have we missed here?
Well, I know that we had a lot of questions, and Pam has done a good job at answering them tonight. I do want to mention, just quickly before we end our webinar tonight, that Terry had mentioned last week that she wouldn't be here, and of course we're missing her, but she's in lovely Costa Rica, am I right?
Yes, she is.
Yes, she is. She is on the diamond trip in Costa Rica, so that's another thing that Young Living is so gracious with, is their trips that they let us go on and the fun that we have. It's wonderful. So we're thinking about her, and she's probably just emptying her mind of anything that would ever be about back here where it's not so beautiful. I mean, the weather is getting better in our neck of the woods, and it probably is up there in Denver as well. But
it is.
This has been good. Somebody did ask about getting a little bit more information on chronic sinus problems, and I think really we did cover that pretty effectively. I would use the peppermint again. Anything that's going to break up that mucus. Just kind of think about what we said, the symptoms were, and then look at the oils that address those symptoms. And this is one of the reasons why we highly, highly recommend the Essential Oils Desk Reference. Because if you're serious about using oils and wanting to learn more about what oil is good for what, that book will address those things. We try to do a good job here with our webinars. But sometimes what works for one person isn't going to be that effective on the other person. So you have to find that oil that speaks to you, that resonates with your body chemistry as well. These are some things to think about as well. Are there any other questions? Let's see. I think that Pam has really done a good job tonight, so I think that she's answered most everything, but I just want to let you know that Pam has written on the bottom of the chat room that to listen again to tonight's presentation, please go to www.letsnetworktogether.com. And I have noticed that some of those aren't getting posted as quickly as we'd like, so maybe when Terry gets back, we'll see what's going on with that. But these are also going to be available, as I mentioned at the very beginning of this presentation, from Crown Diamond Tools within the next couple of months.